We drew the blood for PRP. Now we're gonna put in a centrifuge. Just been.
Hi, what's your name?
Mary Shu.
And why are you here today?
To have Mila give me the PRP, well, the vampire facelift.
And what do you hope to achieve with this?
I'm hoping that the collagen will take over and just start taking away some of the aging process.
Voluma before we do the PRP.
What will that do?
The Voluma, the cheeks augmentation, we try to even them out to make them nice. An upside down triangle, which gonna show the, young looking skin and face.
And this is just washing off
Yeah,
the numbing?
just washing off the numbing. Need to make sure that the skin not gonna be greasy.
How does your face feel?
It's numb, so I'm really not feeling much of anything.
Good.
But that does smell good.
Good.
What's this here?
It's antiseptic skin cleanser. So we gonna make the skin basically sterile. After that, I'm gonna do my measurement for the cheeks and we'll see where we need to add more voluma to make them more even. Yep, just look straight.
And what is this?
This is the basically face map for the Voluma injections, so I would know exactly where to go.
And it's different for every person?
Not really, because the map basically is the same for everybody, but it's according to the face. So, okay, so we see like this side is more loose, more deflated.
This side's the one that's deflating,
I marked the zygoma region, so we would know exactly that voluma start from zygomatic arch right here. I also marked my very dangerous place that I should not go, okay? And I, doing the from ala to the ears, I will see the symmetry and we'll see how the nasal labial folds will go, if this is symmetrical or not. So it's really helped me how to go along and kind of give us a little lift. Okay, little pinch right here. Pinch.
How much do you use per patient?
Usually it's from 1 to 2 syringes. It's depend how cheeks inflated or not, what the patient preferences. So do you see how this cheeks already get lifted versus this one?
Yes.
Do you see the difference?
Huge.
Is it?
Yeah.
Huge difference.
Look at this, how nice and lifted right now. That's what pinch right there. Again, we're using from 0.1 to maximum 0.2 cc per injections. And Voluma is a great choice for the cheeks augmentation. Pinch.
So are you just starting to do this, or have you been doing it?
No, I'm not gonna do injections.
She just wants to see it.
She just wants to
Kinda
see
wanna-
the artwork.
Done.
Uh-huh.
How does it feel on your face?
Oh, fine. No,
With the numbing, you can't feel it?
no, just a slight pinch. I mean, you know, when
Yeah,
she's
from the
playing.
needle.
Yeah, but that's it.
Pinch. We do like a Hershey Kisses injection, so we kind of get up to give a volume on the both side. Okay, now I feel like she's a little bit more deflated here.
Am I that way on this side?
The way we're gonna do that.
Oh,
don't
okay.
worry about. We'll
Well,
make it
I'm just no,
everything.
no, no. I'm just asking. I'm the worst patient. I'm always
No, you're
asking
not.
questions.
No, no, I like the questions
That's the best
that you
patient.
know. Yep, yep. Okay, a little pinch in this here. So we try to kind of lift it, and it also will help with the corner of the mouth. Okay, a little pinch. Okay, see her corner, just get on a perfect horizontal position. Just make sure we don't have any lumpy, bumpy area. Need to make sure that our fillers sit absolutely correctly where I want them to. And we basically ended up with really nice now we're obtaining the PRP. We're gonna get about half of a syringe at this point in a sterile container. That would be our glide. Okay, we have the tip, it's sterile. I would start from here. We're gonna glide. We're gonna start from here.
And is this like a microneedling?
Microneedling, exactly. This is a microneedling. So our glide is right here. Are you doing okay, Mary?
Oh, yeah, I don't feel anything.
Perfect. See, so it's just a noise.
Right, just a
Just
yeah,
a
just
noise
the
that
noise.
make it.
Yeah.
Are there different depths you can set
Correct,
that to?
correct. From 0 to 0.5, we only can do for the forehead, around the eyes, and then, you know, on your cheeks area, that can be a little bit more deeper from 1.5 millimeters to up to maximum that, you know, the pen is allowed you to do.
Now they let you go over just once. Is that it?
Oh, no.
No.
We're gonna
Oh,
do
okay.
numerous layers.
Oh, okay.
We,
All right.
We just started.
Okay.
Oh,
No, I'm just I don't know.
We
I'm just
just
asking.
started. I like to use my finger so I can see exactly where the PRP is. And I start from 0.1 millimeters of her forehead and see she said that she tolerated pretty good. So what I would do, the second row, I will do a little bit more deeper.
Sometimes you see a lot of blood with this.
It's not
treatment. Is that
necessarily,
by patient, or?
it's a per patient. If the patient is more vascular and it's close to the surface.
So it's really called the vampire facial because you're using the patient's own platelet-rich plasma, right?
Correct.
Not necessarily because it's bloody.
Yeah,
I think that's a misconception.
I think so too. I mean, you can go very deep to get the blood, but you know what we're afraid to not cause any scab, because if the patient will have a lot of scab, that's also a high risk of the scarring. How you feel, Mary?
Oh, I'm just fine.
Perfect.